this is what we're doing, or basically this is how the surgery worked out, and he was pretty excited about it. So just a couple things. This you don't need to memorize this this chart here, but the takeaway is that our products that we're going to talk about today, they basically check all of the boxes. If you don't have insurance, or if no insurance is being offered, there may be, if you're more than 50 employees, there may be a potential for a Part A or Part B penalty. Basically, with the products that we offer, it's going to check those boxes. We're going to save money for employer and employee. Typically, we save between 30 and 50%. I know that's a big number, but when you're talking about, generally your third largest expense as far as for a company, after fixed expenses like building and also salaries and labor costs, etc. Generally, health insurance is at least one of the top 5. So when you're saving 30 to 50%, we're talking about a big savings. What we also do, and we're going to talk about this today, we're going to shift a lot of money actually back to your employees and push that into their health savings account. We also offer a more traditional coverage. Sometimes the plan we talk about works. We want to cover all of your employees. We want to make sure that everybody gets the coverage that they need. Sometimes the more traditional coverage is most appropriate for your employees, and we talk about that too. Increased health participation. We want more to participate, cost-effective care. This is why we love teaming up with Sterling. Sterling checks the box on roughly 96% of medical claims. It's going to help to keep premiums down. It's also going to help to give immediate benefit to your employees as soon as they walk in. As soon as you offer the benefit, then they can walk into a Sterling Urgent Care and begin receiving care. In comparison to a lot of plans out there, high deductible health plan has basically a $3,000 deductible before the insurance kicks in. That goes away because of Sterling's involvement. So we're proud to be here with them, and that this can replace expensive health insurance. So what we're talking about today is a combination of 2 parts. There's Planston and then also Zion Health Share. Todd's going to get up and share a bit about how these work.
Yeah, thanks, Kid. So again, happy to be here. Really excited to be kind of sharing some of this kind of innovative product with you. And what we kind of do here is we have 2 pieces, actually 3 pieces. You'll see. We got one here on the left is Planston Administration. It's a base health plan. So Planston is an insurance company located in St. George, been in business since 2019. So it's just like any other healthcare you've heard of, Cigna, Select Health, United, all that stuff. So basically we use Planston and we offer a preventive care or a base health plan. And when we say preventive care, what do we mean? We really mean just preventive care that is defined by the CDC. So some people think, well, I'm going to go have this massage to prevent my back, from getting more hurty. You know what I mean? That's not really preventive, right? As far as the CDC is concerned. So it's really things like, it's really very, very, very small. It's like annual physicals, mammograms, colonoscopies, immunizations, birth control, those kind of things. So very small set of care is going to be given here, right? Which is good because this keeps your usage of health insurance small, right? So we also, with this plan, we have an option for a copay and a health savings account that we'll talk about here in just a minute. Kip kind of mentioned that. That's a big piece, a big plus for this plan, the health savings account. We also can have prescription savings, even though you also can get prescription savings with Sterling Medical as well, which we'll talk about here in just a minute. So you kind of got like really great coverage on prescriptions. Telemedicine, you can also have a telemedicine option with Sterling Medical as well, which is great. And then you can bolt on dental and vision for additional costs. So that's great, wonderful. You're like, yay, it's great, Todd, that's preventive care. So great for my mammogram and my colonoscopy and manual physical. So what happens if something bad happens? Or what happens if I have to be hospitalized or I have a baby or something big, right? Well, in that case, you won't be covered by Planston because it's a base health plan. We're gonna jump you out of Planston and jump into Zion Health Share. So Health Share, anyone familiar with the Health Share here? Some are kind of not, I think people are watching this, right? So some people are nodding their heads, but Health Share is not health insurance. It's basically a group of like-minded individuals that kind of band together. In this case, for Zion Health Share, 55,000 members, and they band together to kind of share on the costs of healthcare, right? So the way it works is it's on a per need basis. So if you're going to have a baby, then what would happen is you submit your need to Zion Health Share. you pay the first, well, for a baby, it's now $2,500, but you pay $2,500 and then the health share pays the rest, right? So, or if I fell and broke my leg and I have to go to the hospital, then I pay the first 1,000 and the health share would pay the rest, right? So that's great. That's on one need. Then if, heaven forbid, my wife falls and breaks her leg and she's gotta go to the hospital, I pay another 1,000 and the health share would pay the rest. And then if my son fell, heaven forbid, but that'd be 3. After that, if I had more, hopefully you would never have that many needs right in a year, I hope. But if you had 4, if you had another need in a rolling 12 months, the 4th need, in that case, you don't pay the 1,000, the health share just covers the cost, right? So it's really slick. The maximum, kind of like exposure to risk would be like $3,000, or in the case of maternity, $2,500, right? So I don't know. We had a member that just had a baby with us here just a couple weeks ago. Great experience. They paid the $2,500 and walked out. I mean, because normally under their old plan it would have been about $8,500, right? So that's kind of what, for just a normal delivery. They had to have a emergency cesarean, so that kind of stuff, you know, makes it more. So it's really good. So that's great. So here we got preventive care covered. We got kind of like catastrophic covered. So the next question you ask yourself is, well, what happens if I just need to go to the clinic? What happens if I just need to go see my doctor because I think I have an ear infection? Or like me, I've been coughing for 9 weeks, right? So yeah, I just need to go be seen by the doctor. In that case, what do I do? Well, it's not preventive, so Plan Center won't cover it, and it's not $1,000, right? So it's not gonna be a Zion Health Share cost. In this case, I'm gonna go to Sterling Urgent Care. That's one option, right? That's the best option. We're gonna go see Sterling Urgent Care, and that's great. But if you don't wanna go see Sterling Urgent Care, then I can go see any provider, because there's no networks. The great thing about Plan Center Zion Health Share, there is no networks. I can go see any provider I want. I present myself as a self-pay customer, and I take advantage of the self-pay rate, and I pay that money with money that's being pushed into my HSA or my health savings account by the plan, right? So, does that make sense? Any questions, kind of like off the top of your head from right now?
Yes, just to clarify, with under the health share, so you can use any hospital?
That's correct.
Okay.
That's correct.
And any hospital across the country, so there's no network. And we work with companies across the United States and their employees, if there's somebody in Georgia or if they happen to be in Idaho, they can go wherever they want to go and get the care that they need.
Okay.
Yeah, please.
So that $1,000 per medical event, say I'm still getting treatment on my shoulder that I injured. I met the $1,000, but we're moving into a new calendar year. Do I have to pay that $1,000 again?
Yeah, that's a great question. So no, you pay the $1,000 once, and as soon as I paid that, then I start getting care. And if it's heaven forbid a cancer situation, it takes 3 or 4 years. I only pay $1,000 amount until I'm symptom free for 12 months, however long that takes. And there's no upper cap, there's no limit, right, to the amount that they'll pay out. And right now, Zion Health Share pulls in, but they're nonprofit. You can look them up on the internet and see their financials. They bring in about $77 million, and they pay out about 89% in claims, because that's what they do. Right? They don't want to just keep it all for themselves, so they pay it out. Please, yeah, Jennifer,
So,
right?
Yeah.
I got it.
Or Rachel.
No, I got it. I just got Rachel out. Yeah.
So you were saying if you go in and then you pay for it, then how do you get reimbursed?
Yeah.
I'm
So.
not understanding the pushing into the health savings.
Okay, perfect. Well, let me go there. That's a great question. So this is kind of a rate table. This is kind of a rate table you can kind of look at here that we kind of start with, right? And this is showing the total rate. So we don't have anything here. We haven't talked with you yet about how much your company wants to contribute, and if so, how much that is. That's part of the process that we go through with you. But you notice here, if I'm employee age 30 to 49, and I want to choose employee only coverage, I'm going to get $100 a month automatically pumped into my HSA by us just by choosing that plan. So the rate is $504, but I'm also getting $100 going into my plan every month, right, automatically, just by choosing that plan. So it's like your rate's really only $404, right? So
Maybe I could jump in too. So if there's something like, for example, that becomes a Zion Health Share need, then you can either work with Zion Health Share ahead. For example, my daughter broke her arm. Took her, got everything taken care of. It ended up being $1,700 when it was all said and done. So we paid the $1,000, then Zion Health Share basically gave us a credit card to pay the other. We didn't have to pay it in advance, you know, and then get reimbursed. Instead, you work with Zion Health Share as far as to take care of those bills. One thing, Jennifer, is the bills with Zion Health Share, the relationship was always between the hospital and me. It's not, they're not billing Zion Health Share. Instead, they're billing me, and then I'm working with Zion Health Share as far as to not reimburse, to either pay in advance. Generally, if they have an elective, if there's a surgery, for example, that's not an emergency, they prefer to pay for those in advance. So there was just like that scenario that I'd mentioned to you, the $18,000, you know, et cetera. Zion Health Share cut a check for that to begin with. When the person walked in to get the care they needed, it was paid for. It was all paid for by Zion Health Share before it was taking place. Does that answer your question?
I'm not sure.
Not really,
So,
it's okay.
So the plan costs like, say, $504. Is that for all of that stuff?
Yeah.
Yes,
It does.
that's
Okay,
right,
and then.
for all of this,
Okay,
yep.
and then, is your Sterling on top of that?
Sterling's
It's
included
blended
in
in
it,
with that.
Sterling's
Oh,
included
okay.
in it, yep.
So
Well, I'm gonna
then
show
is
you
that per person, or how do you do a family?
So that family would be here. If I'm employee age 30 to 49, then this would be my total rate.
Okay.
And if I go here, maybe this will help too. So this shows it broken out, right? So here's what all that, there's that 504 rate for an employee only, right?
Uh-huh.
You can see these are all the pieces that an employee can choose from, other than this one, right? But that shows you how it's all broken apart to get to 504.
Okay.
And another thing that's nice about, in comparison to traditional insurance, is your employees get to select which items that they want to participate in. Instead of a take it or leave it with a traditional plan, they can come along and say, you know, I just want the Sterling Urgent Care and then the health share, and they could do those two pieces. They could choose to say, hey, I do want a health savings account, and so I'm going to do these pieces, and so. So it really gives optionality as far as to the employees. The other thing that's really nice about it too is this 1,083. When we talk about 30 to 50%, it's not. I mean, it's really common to see a rate for $1,600, for a family. That $1,600 is probably going to have a deductible of somewhere around $3,000 to $4,000, maybe $5,000. Max out of pocket from anywhere from $8,000 to $14,000. So. You can see that you get the benefit, like Todd had mentioned, the $1,000 up to only 3 events, and so it really limits the amount that you're going to be spending out of pocket, while at the same time costing less, and also giving care so that as soon as you start with this, and if you've got Sterling involved, if you choose that, you get 96% of what you need taken care of that's included. I mean, you just walk into the Sterling Urgent Care facility. While at the same time, $220 times, this is why the gentleman that I'd mentioned as far as in my story, he'd been on this plan for a year and a half. So he'd had roughly $4,600 put into his health savings account, $220 a month, times roughly 18 months, et cetera. So his out of pocket that he had to pay, it was all put in there by his plan.
And does the HSA amount that's going in there, does that go towards the maximum that you can put in there? Cause like with HSAs, usually they have
It
a
does.
maximum.
That's right, that's correct.
Yeah.
So then you contribute the other amount minus the $220 per month.
You could choose to. Some people max out their HSA if they
We
want.
always max it out, so.
Oh, yeah.
So then you could say, I'm gonna get let's just say you chose this family plan, right? I know I'm gonna get 220, right? So then we could help you decide, okay, then I'm gonna put in an extra whatever it is per month to get me up to the 8550, right?
Yeah.
Okay.
Yeah.
So right now, let's say with my insurance plan, it's like $1,400 a month with Regent Blue Shield.
Mhm.
Yep.
I can only go in Preston.
Yep.
Or Pocatello, has to
Yep.
be Southeast Idaho.
What's your deductible?
My deductible is $7,500
What's your co-insurance?
and, I think it's 70/30.
And then what's your max out
And
of
then the
pocket?
maximum out of pocket is like 14,000.
Right.
But if we go to so you can go anywhere and there's no out-of-network thing?
Correct.
Okay.
So in your case, in this case, if you had some type of an event that was really like a hospitalization, other than maternity, right, then your out-of-pocket cost would be $1,000.
Oh.
And that's where on the family plan, it's $1,000 up to 3 events, you know, and so it's not 3 per person that's a
It's
family.
3 per family.
It's really, as you look into it, and we would love to, obviously that's why we're here. As you look into it, one of the questions we get a lot of times is like, how can you do this? This is like, cause this is so different than $1,400 and a $5,500 deductible and a $14,000 max out of pocket. Just as you think about that, just take into consideration that there's a lot of back and forth that happens with insurance companies, from providers to insurance companies. That's basically eliminated because it's dealt with up front. Zion HealthShare deals with expenses that are, I just mentioned one that was around $18,000, up to a gentleman went in the hospital. He got COVID, he had COVID, 3 months in the hospital, 3 months later he passes away. The bills were up over $1 million. Zion HealthShare paid the bills up over $1 million, gave $10,000 to the family as part of the death benefit that's included, you know, in the package, and the family paid that $1,000, and that was it. So it is, health insurance is a mess, right? I mean, it's complicated, it's motivated. Health insurance is built to basically condition us to go in and basically put a card down and say, well, I guess I just have to pay my max out of pocket, or I just have to pay my deductible. It doesn't have to be that way. And keep in mind that the gentleman that sent me that analysis, if he had run that through Regents at $60,000, the company's rate, this was a company of 70 employees, they ended up with about 36 that were insured. The company's rates would go up the next year because of that utilization. So as small companies, when I say small, anywhere from 0 to 200, you know, employees, it's really tricky to offer health insurance and make it affordable when you've got people, when they use health insurance, that you get punched in the nose when it comes time to renew rates. In this plan, if you go back, in this plan, you go back to, this now spreads your risk over not, let's just say that company has 36 employees that are insured. This now spreads the risk over 55,000 people. So your rates are not gonna, they're not based off of your 16, 36, whatever, you know, employees. They're based off of now a pool of 55,000 people. And so it's really, really powerful. It really jumps you into a much larger, spreading the risk, you know, and a much better way, especially for those small to medium-sized businesses of you know, being roughly 200 employees. I mean, from 0 to 200.
Is there no like health thing that they have to do, or
Oh, like a questionnaire?
Or pre-existing conditions or anything?
Yeah, great question. Let me answer that, and then you can jump into employer. Yeah, great question. So we mentioned that we want to take care of all employees. You know, so sometimes, so generally, Jennifer, when we walk into a group, generally what we're talking about here is going to be chosen and or is going to work for about 70% of the employees because of pre-membership conditions. Now, Zion HealthShare, if I thought, for example, obviously I'm on this, if I were to get, if I were to be diagnosed with cancer, then everything would be paid for minus the $1,000 because I'm a member of this, right? But if somebody that's not a member had cancer and learned about this and said, well, crud, I'll pay my $1,000 and then have it pay for everything else, it wouldn't work for any of us, right? So the way the pre-membership conditions work is they don't say, hey, you're out of luck. Instead, what they do is they say, if somebody wants to jump onto Zion HealthShare and they have a pre-membership condition, which is defined as anything that somebody's been diagnosed with, being treated for, been examined for, taken medication for, then that's a pre-membership condition. It's something
in the last 24 months.
Yeah, they look back if you did jump into that. You know, if there was a need that was submitted, they'll look back in the last 24 months of your history and see that, oh, yep, you didn't have this. It was my cancer situation, for example. Then they pay I pay the $1,000, and they pay the rest. But if somebody does have something, then what Zion HealthShare says is in the first year they pay $0 for somebody that's on this. And the next year they pay up to $25,000 for a pre-membership condition. Again, it's just something that I had before I jumped on Design Health Share. The third year they pay up to $50,000. The fourth year and thereafter they'll pay up to $125,000. So as our enrollment team talks to every employee that we work with and ask them to try and make sure that this is going to be a fit for them, we ask them questions like, well, what medications are you taking? Do you have a pre-membership condition that we should talk about? Sometimes we get somebody that says, yeah, 3 years ago I had a heart situation and I had to go in and I had to have, you know, stents put in or some really major stuff. And then we say, you know, so they say, I get seen by the doctor every 6 months. That is a pre-membership condition. Do we want them on this plan if they have the potential of a heart situation that Zion Health Share is going to cover 25, year 2, 50, 125? No, we don't. So we put them on a traditional plan that's much like what you just described as far as with either Regents as a carrier we work with. We get them on an open market if you're less than 50 employees. We find them generally better care than they're currently getting from the group plan that they're on because of the options that we have and just how we do things. So, like I said, generally about 70% of employees, this is going to be awesome for. The other 30% may say, well, you know what, I got a pre-membership condition that I'm working on right now. A couple that have been a little, and we always are obviously very clear with the employees. One guy came along and said, hey, I need my knee worked on. And he said, but I think it's fine for he thought, well, I'm just going to wait for the year and $25,000 will cover it and that'll be great because I'm tired of paying $2,500 a month for his insurance premium. 25 grand is what, $2,500, $30,000 a year is what he was paying for he and his family, and he had a $10,000 deductible. So he's like, I want to jump on this thing and I'll just wait my year and then the $25,000 of the Zion Health Share. And we said, well, that's up to you. You know, we're just telling you how it works. But it does work, and it works really, really well. We just want to make sure that we get your employees in the right spot. As we do build out a strategy, you know, there's obviously the content part of helping your employees understand that. That's our job, and we're I don't mean to brag, but we're really good at it. We help your employees understand how it is and how to utilize their benefit. Todd's going to show you and walk through now as far as how an employer contribution, because an employer generally puts some of the money into it as well, and how that blends in as well.
So this is back to that total rate. We've been looking at the total rate. So like Kip mentioned, so then we sit part of our HCap strategy. That's why the name of our company is HCap Strategy. We build a health strategy for you, right, based on your needs and how you want to do the company. But this is kind of like our general amount. We usually kind of say, hey, it's if the company would put in 200 for employee only, 400 or 500, right? That's kind of where we start with, right? Some companies say, oh no, we can't do that. We're just going to do 200 across the board, right? Or other companies say, no, we want to do more than that, which is even better, right? But we talk with you guys about what kind of strategy you want to do for contribution. So now if you take this contribution rate, this is the total rate, remember? So now if we add in this contribution, now you can kind of see what it would look like for an employee. So in this case, the employee cost would be $300 a month, but they're also getting $100 a month in their HSA, right? So this is showing the employer will match up to like $50 a month, right? So yeah, I'm paying $300 a month, but I'm getting $100 back more in my HSA, so it's really like I'm only paying $200 a month, right? Which is pretty reasonable. Same down here. This is that employee family. Total rate's $1,000. Companies put in $500. I'm going to pay $583, but I'm getting $220 a month in my HSA every month, right? So yes.
So, question: we do have some people joining virtually.
Oh, okay, yeah.
Is there with the Zions versus a traditional health insurance plan? Is there any IRS tax issues difference?
Yeah, with their traditional versus
Yeah,
it's a great question. Yeah, please go ahead.
Yeah, so that is a great question. So the Planston portion that is health insurance is tax deductible. The HSA, the health equity portion, again, is tax deductible. When we send a payroll report over to the companies that we work with, we detail out of the employee contribution, the amount the employee is paying, the part that's tax deductible and the part that's not tax deductible, because memberships are not tax deductible. And so that's how, in comparison to like on a Regents plan, that whole Regents plan, whatever amount the employee is paying towards that can be payroll deducted and say payroll taxes. So this is not a not. So
Okay.
Is that good?
Yeah, thank you.
Yeah. And then this is just kind of, this was a snippet, right, showing you kind of like just a couple. Now if we put it all together, we build a website. Part of the other strategy we do for you is we build a website for you, for your company and for your employees to look at. And this is what we would put on it, along with a whole bunch of other stuff. But this is the rate table the employees could see in this example, right, for what it would cost them. And I can make a determination on how old I am, what level of coverage do I want, and then I can see it all broken down, and then I can decide. Like we mentioned, maybe I don't want to put $50 into and match. Maybe I only want 25, or maybe I want to put more. Like to Jennifer's point, maybe I want to put more HSA money in there, right? That's great, right? So it's a chance to like sit down, and when we talk with employees, we send this out, and then our enrollment team meets with each of your employees, and we start talking about these kind of things, right, with them as we enroll them. So yes.
One more question.
Please.
So, with some of our companies, well, a lot of our companies, they're self-funded or partially funded with their insurance. And so they're able to review utilization when it comes to time for renewal to see where the money's being spent.
Yep.
With these different plans, do they provide utilization reports?
Yep. I'm gonna let Kip answer that.
Yeah, awesome questions.
Good questions, by the way. Yeah.
So it's a little different mindset, because keep in mind that the Planston portion, what it's going to be utilized for is preventive, and it's going to be very limited. The short answer is absolutely. They're going to see as far as what the utilization was, as far as on the Planston portion. When it comes to Zion Health Share, and this is what's really cool, is no, they aren't going to see how this is utilized. And it's not going to affect their rate.
Right.
Because it's spread over 55,000 people, not over just their employee base. And so when renewal time comes, the renewal rate, if we get really technical, this is a self-funded plan. This is a self-funded, and so these rates, they may take and change and fluctuate. But when they take and change and fluctuate, it's only based off of, let's say, for example, if everybody in the company went and got something expensive that is covered by preventive, like everybody just decided that it's the month of colonoscopies. So everybody in the company goes and gets a colonoscopy. Well, that's an expensive, that's an expensive procedure, right? That is covered 100% by Planston. And so when it comes time to renew, then there would be a rate change. But this is really dialed in. The insurance portion is designed to only actually cover a very small amount. It does that so for a couple of reasons. One, it makes it so that the Zion Health Share can really do the heavy lifting. Two, to utilize, to basically limit the amount that's being covered by design, so that Zion Health Share does the rest. And three, to get you a high deductible health plan, so you can have an HSA, so you can have a health savings account, so you can have the power of the
and keep your rate low too.
And to help keep your rates low. Yeah, so your volatility of, like, I was just with a broker in Salt Lake, and he said last year we were a 10% increase across the board for everybody that he'd worked with. This year it's 15%. In 2 years, he's talking about his company as a whole, was a 25% change. In 2 years, 10 years, 10%, 15%. You don't have any, that all goes away because you're now being covered by a group of 55,000 people. And in a way that's done that you're, again, keep in mind in that scenario that I said earlier, hospital was going to bill 90, insurance would pay 60, self-pay through Zion Health Share, 18. So it's night and day as far as in terms of what the utilization is.
Yeah, and one thing that Sterling, and we'll get into that a little bit with the membership program, when you're presenting self-pay, if it's like for an MRI, CT scan, that type of stuff, we actually have a case management team that will actually do the negotiation. And it's amazing if you're not using the health insurance and you're just presenting as a self-pay with the Zion's Health Share, that you get up to an 89% discount. So for example, Cache Valley Hospital, if you go in and you present your insurance, you're going to pay your deductible, that type of stuff. But if you present as self-pay, for an ultrasound, normally it's $300, but you're going to pay $32. So there's huge savings when you present as a self-pay. It's almost like you get penalized for using health insurance. Yeah.
So you guys have people at the Sterling Urgent Care that will help our employees set that up?
Correct.
Yep.
Yeah.
And so does Zion Healthshare, both. So you almost have like, and so do we.
Yeah,
It's like you got like multiple teams, right, that are kind of behind you as a benefits team, right? So.
Yeah, so Sterling, again, we're trying to help employers with their premiums as well as our patients. And so if we ever refer a patient outside of the clinic for MRI, CT scan, we don't just hand them an order and be like, okay, good luck with that $2,000 bill, right? We actually reach out. We have a whole team that will reach out to our patient and say, hey, it looks like we have an order for an MRI. Are you self-paid? Do you have insurance? And then we're going to help negotiate the best rate for them.
So isn't it really cool? I mean, as you're thinking about this as it wraps together, first off, risk is limited to the employee through Zion HealthShare, right? You've got a great team as far as in Sterling Urgent Care that's going to take care of 96% of what the needs are as soon as you jump into it. You don't have to hit a deductible, etc. You got a health equity account, so tax advantages of that. I'd just like to share a couple stories for you, at this point. These are real life. These are not acted. This is real, true, honest to goodness stuff.
Names have been changed to protect the innocent. Yeah.
So, trucking company that we work with, he got back in touch with us. He said, I took my wife in for an emergency appendectomy. I just did the math on our old plan. He was also on it. They were also on a Regents plan. On our old plan, we would have been $6,700 for that appendectomy to come out. He says, with you guys, I was $1,000, but you guys had put that much money onto my HSA, so I actually paid out of pocket $0. Sat across the table from a guy that was looking at doing this, and he said, Kip, let me just share an experience with you. I just had one of my employees go in, and his wife needed her gallbladder out. He said he went in, he came back after being on, a traditional plan, came back with a bill of $7,200. He said, this is one of our production guys. I mean, he doesn't have $7,200 bucks, and I'm paying $1,400 a month for this guy. Between me and the employee, we're paying $1,400 a month for him to have the experience of going in, getting his wife's gallbladder out, and coming back with a $7,200 bill. And he's grumpy. He thinks our insurance stinks, but I'm just struggling as far as to pay the $1,400 bucks. He said to me, if I understand this right, he would have had a $1,000 bill. And I said, well, it depends on when that actually happened, because $220 would have been going into his HSA every month. So, I mean, if it was after 5 months, he would have paid his first $1,000 with that money that was on his HSA account, and he would have come back and given you a great big hug. I mean, these are real, honest to goodness, examples as far as of how companies are benefiting, from the plan. Let me just go over a couple of things so that we don't take a ton of time. We also have traditional plans, and the only reason I bring this up is because I'd mentioned 70% are going to love what we came up with. The other 30% may have a pre-existing condition, pre-membership condition, etc. We want to take care of them too. Depending on the size, if we get, for example, if we anticipate that there's going to be 15 to 25 or more people that are going to need traditional coverage based off of the numbers, etc., then we're going to get you on a plan that's just like this. This is an embedded deductible plan. We won't go into that, which basically means it's great. You can see as far as $3,500, for the HSA, $3,500, $7,000 for a family. You can see it's very much like what you guys are all kind of used to, and etc. But we have options for traditional plans. So it's not like we say to your employees, hey, you're just out of luck. Instead, we help them out and get them on there. We also, too, if you're less than 50 employees, then instead of having a group plan, those that need actually traditional coverage, we can look at being on the open market. An open market plan, this is actually for 2025. It says here somewhere, I think. So, yeah, right there. Somebody that has a household of 5, 2025 household income of $100,000 would get a subsidy of $1,700. They can have plans as low as $28 a month. Here are some plans that we can help them to get on. You can see this is a $1,900 plan. Get them on it for $172 bucks. Here's a $2,200 plan, $497. Brand, names that people know, recognize, so we can help them do that as well. However, keep in mind, the reason that generally if people can jump on the plan that we've been talking about that involves the health share, even if they could do this, is even say, for example, if the premium is less for this family, do they really want to get into a max out of pocket of $9,200 bucks where they could be $1,000 per event? Like one event, like the gentleman that I shared starting out today, that $18,000, you know, it was actually ended up being, what was it? I mean, $54,000. He would have hit his max out of pocket with that one event. So yes, it might be less per month sometimes, maybe depending on income and subsidies and, you know, et cetera. But if you have an event, our plan, I mean, our plan doesn't, the other plan keeps more money going into your HSA, limits your risk, and is pretty awesome. But we want to take care of all of your employees. Again, oh yeah, please.
What's the minimum amount of employees that you have to have for your
great
designs?
Great question, Sammy. Yeah, so as far as, so you need 2. And there doesn't need to be an actual, like a percentage of your population that jumps on. So the plan that we were talking about, you need at least 2 people on it. We also do work with individuals that, like, for example, there's a farmer in Garland called up and said, hey, I know you guys work with, you know, this company, but I don't work for them. We can help get them on a variation of this. Just, it's not you don't get a health equity account, you know. So we work with companies of all sizes. But you need, with what we're talking about here, you need at least 2. So yeah, great question. So you can kind of see, this is where I was talking about the, you know, if somebody, this is it's a little bigger company, obviously, right? 113 employees, they were spending $1.5 million on a traditional or an MV minimum value plan. 70% jumped on the plan with the health share that we were talking about. That took their saving, or that took them from $1.5 to $860,000. This did a scenario if they were 80%, then it would be, the savings would be even less. But generally we find, or savings would be even more. Generally we find that 70-30 is pretty common as far as in terms of, well, I think that we did a manufacturing group. They had 26 employees, 25 jumped on this, and 1 actually didn't. So it just kind of depends. So you can see as we wrap this up, you can see the power, the benefit that comes from taking a health insurance product that's going to cover preventive, going to give you a high deductible health plan, which means you can have a health savings account. Awesome, right? Jumping into Zion Health Share. Zion Health Share is going to cover for $1,000 per event, up to 3 events. It just works. It's awesome. It's great. Employees love it. Employees love being able to choose what is going to be the best fit for them. Sterling Urgent Care, what a great partner to be able to walk into any Sterling Urgent Care, 21 locations now, to be able to go in, get the care that you need, cost you $0 unless you get labs and x-rays, and then it's minimal cost. But to have a team of Sterling Urgent Care working as part of your strategy to deal with your health insurance is pretty doggone awesome. And then the health equity, I mean, to be able to take advantage of that money that from your plan at that $1,083 for a family that's flowing into your health equity account. My wife loves it because, you know, sometimes she and I see things maybe just a little bit different as far as in terms of what to do with it. Like, for example, I'm probably more the guy that's like, hey, you know what, McKay, my son, suck it up. You're going to be fine. You know, quit coughing and, you know. Anyway, she can take that health equity card and she just uses it. You know, she uses it for braces. She uses it for, you know, any qualified medical expenses, which there are oodles of them. So it becomes a great part, and if you don't use it, like for example, it's not like a flex spending account that you have to use it in the year and it expires. Instead, it just rolls over. So it becomes, we work with a couple accounting firms. They tell all their clients, max out your HSA. That's your money. You get to use it before you're 59 and a half. It's a great little retirement start, you know, as far as for employees to give them the benefit of that is really something powerful.
And the money stays with you as the employee.
Even if they left.
Even if you leave the company.
Then it's their money.
Is yours.
It's their health savings account. So it's a really powerful, you know, tool. Okay, can I borrow your brochure? Inside of here is just a reminder, you guys, as far as, you know, the little brochure, you'll see the Venn diagram. Also the rates that we've talked about gives you the idea as far as what the rates are. These rates too, we really don't have to get you quote, you know, we don't need a census necessarily. These rates stick. It's if we do the traditional plans, then census, you know, information becomes a part of that. But you can look at those rates and be solid and confident in those rates, because that is the rates that we charge. So, Sammy, what did we miss?
Nothing, I was gonna maybe.
She needs to present too.
Yes, I will present, but I was maybe gonna put Riley on the spot if she doesn't mind. Because she's had a very recent experience with Zion's Health Share, so would you mind sharing your story?
Yeah, so I got on Zion's on my own, and because I work in healthcare, so I understand the insurance. Oh, sure.
Start over.
Okay, so I got on Zion's on my own, just because I've seen insurance for a long time and didn't want to use it because it didn't cover me the way that I wanted it to. So I actually just had a baby a few months ago and did Zion's through the maternity, and it was super easy. I got with my OB, so all my prenatal care, I paid that monthly, and so that went towards what my Zion's unchargeable amount. And by the time I had the baby, I'd actually already paid the $2,500, and so I just submitted my bills to Zion's. They paid them, or they sent me one-time use cards to pay them, and it took a minute. Yeah, it was super easy. So super happy with it.
Congratulations.
Let's give her a round.
Yeah.
That was awesome.
She actually oversees our case management department, so she really knows how the healthcare system works. So.
Great, thank you, Riley. Any other questions, thoughts? Yeah, please.
Is this including the dental and vision, or
Oh.
is that on top of that?
Yeah, great question. So dental and vision bolt on separately, and you're going to find so it's not included in that amount. So your dental and vision, you're going to find that it's very comparable as far as in terms of cost to what's out there, and in terms of coverage level. It's a little more like it's not a cut rate dental plan or vision plan. Instead, it's going to cover, like, it covers up to $5,000 a year per member. You know, the enhanced does, or you can do it so that it covers $1,000. So, but yeah, it's in addition to, and we're happy to get you information on that too, Jennifer. Yeah, great question. Any other questions? Well, good. Well, we're going to be around, obviously, so feel free to, we're happy to meet with you guys. There's obviously a fair amount of things to go over as far as if somebody is interested. A few things that we need to work through and helping you guys to understand. The enrollment process, depending on your company size, but it can be as quickly as within like 11 days. We do enrollment meetings. We meet individually. Our enrollment team calls and talks to each one of your employees. You don't have to do a bunch of heavy lifting. There's some paperwork on the front end, so it's really relatively easy as far as to get it going and to go from there. And then we are on your team, even to the point as far as a lot of times, we build you a website, we give you a keychain to give to your employees, they get their insurance cards, but we're on your team as far as to help them to understand how best to utilize their benefit, what to say when they walk in an emergency room situation, when to use their card, when not to use their card. So we help your employees. Your employees are going to understand how to use the plan. So
I would just say one other thing,
please.
real quick. If you're thinking to yourself, well, we just already went through enrollment. We're done. We don't, we've already enrolled. We don't have to worry about this for another year. That's true, but you can switch over to us, right? At any time, we can switch you over. It's not a big problem. We switch you over, and then of course your effective date would stay. Like if you decided to switch over in April, it would stay April from then on. But you're not locked into your current, effective date. If that's something you're interested in.
Todd brings up an excellent point. And I'll just add to that as well that if you've got a current carrier that that's been with your company for a long time, we're happy to work with them as well. So if they stay in place, and then we also offer this so your employees have choices, we're happy to talk with the carrier and or work with them. A lot of times they may have participation requirements and say, nope, we're not going to do that, which puts you into a situation to say, well, why don't they want to do that, and what's best for my employees, et cetera. But, if there's somebody, we had a company that we worked with that the owner of the company was going through some cancer stuff, pre-existing condition, right? So they wanted to stick with that plan, so they offered both, and that ended up working as well. So. Yeah, so great point. Well, thank you very much. I'll switch over the presentation.
So I get the fun part, the membership portion. So I know the membership, a lot of you are very familiar with the Sterling Urgent Care membership, but there's a few of you that it's actually pretty new to you. So if I bore the ones that already know about it, I won't be offended if you walk out. But I love presenting this, so.
So again, one thing that we do is we come out and we explain to your employees that when they hear Sterling Urgent Care, they think that's where I go if I have like a broken bone, a laceration, some type of urgent care need. But what they don't realize is that we actually treat 96% of their health care within the clinic. So that's anywhere from like diabetes, depression, anxiety, wellness exams, sports physicals, DOT physicals. And the employees don't realize that when they use the health insurance and they're using it for like their everyday primary care, urgent care, that type of stuff, that's what's driving up the costs of the health care. So we really come out and we educate them and make sure that they understand all the services that they can get through Sterling. And again, they have unlimited access. So they can come in 1 time a month, they can come in 30 times a month. There's no limit on how many times they're seen. And they're never gonna have a copay to see the provider. And again, in return, you're not gonna have a claim that's generated on the health insurance. So again, I went over, there's common general illnesses that we see. We also do adult illnesses, but one of the big questions is, do you do pediatric care? Yes, we do. So if you have a little one with an ear infection, usually you have to call into the pediatrician and say, hey, can I get an appointment? And by the time you get an appointment, they've got a fever and now you're in the emergency room, right? So having that ease of access for that pediatric care is really convenient for our patients. Another thing is the virtual care. So Sterling, we've always offered telemedicine with the membership, but we've actually expanded that. So say you present to the clinic and the clinic is very busy, maybe they only have 1 to 2 providers. What we're doing in our clinics is we're actually setting up a room to where you can do a virtual visit with a provider that's at a different facility that maybe isn't seeing as many patients. So what that helps do is decrease the wait times, but then that provider that's visiting with you virtually can work with our nursing staff in the clinic to get you those prescriptions or x-rays or whatever you need there. So that really will be a convenience for our patients, especially if the clinics are getting overwhelmed with influenza, that type of stuff. So with the membership, we have a full in-house laboratory. So the majority of the labs that you get done in an urgent care, primary care setting, we can do those in-house. Examples of those labs are testosterone, kidney, liver function, urinalysis, pregnancy tests. If they have a membership, they just pay a minimal $20 fee at the time of service. The company does have the option to opt in to pay for those fees. Some of our companies do, but a lot of our employers just leave that responsibility up to the employee. Yeah, go for it.
So, say they want a whole list, like they're doing a wellness physical and they want a whole list of labs done. Mm-hmm. So is it still just $20 or is it $20 per test? Or?
Yeah, if it's a lab that we do in-house, it's $20 per test, which is very minimal because a lot of those tests are $70. I mean, I actually got a phone call from one of our members that she went to a different doctor and he ordered all these labs and she got a bill for $2,000. I'm like, oh my goodness. So the labs that we can do in-house, again, those are $20 per lab. But say it's a more complex lab that we can't do in-house. That would have to be sent to an outside laboratory, but what we can do for our members is we can actually get them 50% discount on those labs if they're self-pay, or if they do have insurance that covers, say they have Planston, they're getting a wellness exam, we can send over the Planston insurance to the labs. That way it gets covered 100%. Does that make sense? Yeah. Again, that's where I keep calling them the case management team, but the account maintenance team, they'll help the patients with that. So say they get that $2,000 bill, they can reach out to our team and say, hey, help me, I don't know what to do. So we're used to it.
Your name again? Mine's Riley.
Yeah. She works miracles. We do have a in-house pharmacy. Again, we carry up to tier 2 generic form medications. Our medications actually come in pre-dispensed. And so that's more like your antibiotics, your Z-Paks, birth controls, those types of medications. Those are available for our patients for $15 and we can just dispense it in the clinic. Now, somebody may say, well, I could go over to Walmart and I can get that prescription for $4. Well, I'm going to go to Walmart and I'm going to walk out. My cart's going to be full with like $100 worth of stuff that I didn't need, right? So I'll just pay that $15 at the clinic. Now, there are medications that we don't offer in-house, or controlled substances, or that type of stuff, but we actually have great relationships with pharmacies here in the community where they've actually agreed to discounted rates for our members. So say you have a more expensive medication, or it's one that we don't offer in-house, again, our account maintenance team can step in and help you with that.
Maybe just to add to that.
Yeah.
Sammy, if
Yeah,
you
go
don't
for
mind. So keep in mind too that you have a prescription benefit on the Planston site as well. So you've got a 2-3-pronged approach to be able to get so we use a PBM, a pharmacy benefit manager, that is actually located back east. They mail it for maintenance drugs. They ship the drugs in. So you have. We're just going to help you find the best way to get the prescriptions that you need. Yeah.
And what's the usual cost for the maintenance drugs, you know?
Well,
Does it just depend on what drug it is?
it definitely does. But one thing to keep in mind, and again, I'd mentioned as far as the health insurance in general is like a mess. So a drug provider is going to charge as much as they possibly can. So if you have a health benefit that covers really good, it covers your prescriptions really good, then they're going to charge your health insurance a lot of money for that prescription. But when it comes time to renew, it's going to be expensive. That's going to cause your rates to go up. Well, with this plan and how it's set up, it's not designed to have it cover really good, which then jumps you into what's referred to as a prescription assistance program, which then makes it so that you keep costs down. It's just designed in a way it just makes sense to all of us in this room. So yes, we do cover one way or another. You're going to get awesome coverage, for prescription, for the prescriptions. So.
Yeah. And a great example is I actually went into the pharmacy to fill a prescription. I've always presented as self-pay because I've been on Zions. And then I actually signed up for some health insurance this year because I'm like, I just kind of want to play with this. So I left my family, my husband and my son on Zions. I signed up for the health insurance, but I went in to fill my prescription. And she's like, she had me a self-pay. She's like, this is what it will be. I was like, you know what? Here's my insurance card. Just run it through the insurance and see what it would be. I actually would have paid $60 more using my insurance card versus just being a cash pay patient. So my husband as well, he had a prescription. It was $500 a month. I went to, because I've been part of Sterling negotiating, I went to CanadaDrugsDirect.com and I got that same prescription for $60. So it's pretty crazy. Oh, x-ray, can't forget x-ray. Each of our clinics is set up with full x-ray capability. So say you have a little one jumping on the tramp, I've got a boy that rides a dirt bike, and you think that maybe they have a broken bone, you really sit there and it's like, oh, I don't want to go to the ER, urgent care, and pay for an x-ray. It's going to cost me $300, right? And then I'm going to get a separate bill from a radiologist. With our membership program, they just pay a $20 fee, and that also includes the radiology read. So they're not going to get a separate bill from the radiologist. So you don't have to make your 15-year-old sit there and suffer with a broken bone. You can actually just come in. You can come in one time. You can come in 3 times, and we can take care of those x-rays. We also do fracture care. So say that we do find that there is a fracture, we can take care of that fracture. We also do the follow-up care. Now, maybe it's a fracture that it could affect a child's growth plate, or it's one that actually needs to be surgically fixed. Again, that's where we'll push it over to the case management team, and then they'll help you with the process getting into that ortho or getting that surgical procedure done. EKG, if you're having a heart attack, please go to the emergency room. But again, we want ease of access to healthcare so that we prevent the catastrophic things from happening. The catastrophic things are what puts high claims on the health insurance, right? So if you feel like you're having heart palpitations, you feel like maybe there's just something going on with my heart, you can come in. We can actually do those cardiac labs in-house, $20 per lab. With your membership, if you go over to the hospital and you get an EKG done, you're going to pay $600. If you get an EKG done in the clinic, $0. You don't pay anything. We also can check lung capacity. We do a ton of foreign body removal, so a piece of wood, metal in the eye. All of our clinics have that capability. Maybe you get a little one that sticks a bean up their nose or in their ear. That happens all the time. You can come in and we'll actually take care of them in the clinic. Our providers, I like to say that we have the NFL draft. We really take time in making sure that they have great bedside manner and that they have great knowledge. A lot of them, their background is in emergency medicine, and so they're great with children. You know, you've got a little one that comes in with a laceration, they're upset, they're screaming, that type of stuff. Our providers, they know how to handle that, and they do a great job. And the one thing that actually is going to bring our patients back to our clinic is that experience with the provider. Because if they have a bad experience with one of our providers, they're like, I'm not coming back. So again, we really want to make sure that every patient has a good experience. Laceration repair, again, we do minor lacerations, but we do very complex lacerations. I keep using my kid as an example. He actually split his knee open. And he called me, I was in Idaho Falls, and he's like, Mom, I'm in the driveway, I split my knee open. So I had my husband go get him. My husband calls me, he's like, it's pretty bad, like he's got an artery. And it was like shooting. And normally those are emergency room visits, right? But again, we took him to the clinic and I was like, you can do this. Our providers had that experience in the ER and they were able to take care of that in the clinic. So it was pretty awesome. I went over the lab tests that we do. We do a lot of preventative screenings. Vaccinations is a common question. We do very minimal vaccinations just because the need for them and the cost, they just sit on the shelf and they expire. The vaccines that are available is actually your Tdap and also your flu vaccine. Those are not covered through the membership, but they are available at a discounted rate. Our employers too, we work with them around flu shot season because some employers are like, you know, I want to pay for all my employees and their families to get flu shots. We'll also provide flu clinics, so we'll come on site. That way they're not all having to come into the clinic as well. Screenings and physicals, as I mentioned, whether you have a membership with us or not, missionary physicals, no matter what religion you are free at Sterling. So share that with the community. But again, if you need mission physicals, sports physicals, DOT medical cards, those are all covered through the membership as well. Again, we do educate the employees when you need to go to the emergency room if it's life-threatening. We had somebody show up at the clinic. I had gone out and presented to all the employees. They had a $7,000 deductible before anything was covered. So the employee actually, he was excited about his membership, but he got in a fight with his girlfriend over the weekend and she stabbed him in the back 3 times. Well, he showed up at the clinic to be seen under the membership because that's affordable, right? Well, that was a very expensive ride across the street from the North Clinic over to the emergency room, and he ended up like in ICU. So again, just really, we really want them to know that we'll do as much as we can, but there still is that 4% that needs to be treated elsewhere.
Something sticking out of your body.
Yeah.
Go to the emergency.
Yeah. Yeah. So one thing I encourage everybody to do is we have an amazing website. If you just go to sterlingurgentcare.com, it works great on your phone. Dan actually has done a lot of updates on it. It will actually find your location. It will show you where the closest clinic is to you. It shares information, testimonials on all the services that we offer. It's got videos. So again, I really encourage people to go there to look at the different locations. This list, it doesn't fit anymore. But our most recent one that I need to get added on here is we've actually opened up in Montana. So we've got our first clinic in Montana. So if your employees are in any of these locations, their membership is not just good at one location. They can utilize it at any of them. Again, we've really expanded our telehealth. So say they're out on vacation, you've got somebody that's getting strep throat, it's like, oh, I know it, I feel it, it's coming on. You can get on, do a virtual visit with one of our providers. They'll call in a prescription, and that just saved you a couple $100 from going to an urgent care out of state. So.
Do they just get on the website to get a virtual?
Yeah. So yep, they can just get on the website, and they can just request to do a virtual visit. It's really easy. So. Yes, I actually was going to check with Dan on this. Is the app available yet? Do you know?
The app is available. Virtual care on it is not linked yet, but it will be soon.
Yes.
Really?
Yep.
Cool.
So, and they can actually, the great thing about having the app on their phone is they can access their medical records. So say they are going to a specialist and it's like, oh, I should have gotten those records from Sterling. Instead of having to call in and try to get those, they can actually, we set them up with a patient portal, and they can access that through the website or the app. Any questions? Yeah.
Do you guys do like pap smears and stuff like that for the ladies that?
We do. Mm-hmm.
Okay.
Yep. So with the pap smear, it's a complex lab, so that would actually be sent out. So you'd get billed for the lab from that third party, or say you had Planston, a pap smear is preventative usually, and so we would send the Planston insurance and it would be covered. So, but yeah, women's health, we do all that kind of stuff. If you just need to come in, annual exam, get an order for a mammogram, that type of stuff, it's all covered through that membership. So, date night, Friday night. Awesome. Any other questions? I know the membership, a lot of you are pretty familiar with it, but like I say, it's the easy part.
Can we just sign them up anytime?
You can. So say you've been using the HINT portal a little bit, right?
A little bit, yeah.
Yeah, so say you have a new employee that comes on, you don't have to wait a certain amount of time to enroll them in the membership. It's actually a great benefit to retain employees. Say you offer the health insurance plans to your full-time employees, that type of stuff. Say you have part-time employees. They need some sort of benefit, right? And so you can offer it to those part-time employees. The employer doesn't have to pay for the full membership. So there's many different ways that you can offer it. You can say, hey, we offer this as a benefit, but it's available at payroll deduction. Or we offer it as a benefit to our part-time employees. We'll pay your portion, but if you choose to add your family on, we do payroll deduction for the family difference. The membership is not health insurance, and so we work with you to figure out how you want to offer that.
Okay.
So.
And one little plug too. So companies that we work with, as they send the new hire, basically it makes it as easy as far as to let us know who the new employee is, and then we reach out to them, go over all of the different offerings. If they sign up for Sterling, then we take care of putting that into HINT, and actually enrolling them, sending you over the payroll, reports, and so we really become an extension of your HR and just handle all of that for you. So
Yeah.
Sammy, can I just add one thing?
Yeah.
So if your company has a membership, there's no contract, so it's not like you have to have it for X amount of time or years or anything like that, which is really nice and convenient for people.
Yes.
And telemedicine is also, or virtual care is also included with that. So
Yep.
that's just such a great benefit to have, especially for people who are traveling or don't want to come in or something like that.
Or live in Preston and don't want to drive to Richmond.
Yeah.
So the virtual care, it's becoming very, very popular, and like I say, they have unlimited access to that for free. So to sign up for the membership, it's just a membership agreement, just so that the employer understands it's not health insurance, it's a membership to the clinic. But like Dan had mentioned, you're not locked into any type of contract. So, and we haven't had to do that because usually when employers sign up for it, they keep it. So it's a great program. Okay, any other questions?
do you mind if I just mention one other
go
thing?
for it.
A lot of this is about education. It's about helping your employees to understand the benefit and what it is. I mean, it's awesome if we could have Sammy talk to every employee, et cetera, then they would understand the benefit and they'd use, they would use it. That's part of what we do collectively is we want your employees to understand how it works. We want them to have resources. as far as who to call. So we really are proactive in helping your employees understand the benefit and use the benefit. We want them to use the benefit. So kind of to that point, if somebody isn't going to get charged anything for going and getting the care that they need for a sinus infection, they're going to get that care a lot quicker. They're going to be back to work a lot quicker, and they're going to be more proactive with their health. And so it becomes a benefit actually back to the company, because you're going to have healthier employees that are being more proactive with their health in comparison to being like, I don't want to pay the $60 to go in or whatever. So
or they call in sick, the Monday after Super Bowl. Like, I feel like I got the flu, I can't come in. It's like, well, you have a Sterling membership, so go get a doctor's note.
Yeah.
So, awesome. Thank you.
Yeah.
All right. Well, I appreciate you guys taking time out of your day to come out and listen to us. I know the membership, can be repetitive for some of you, but thank you. Perfect.
We'll be around if you have some questions.
Questions.
Like that, so.
Yep.
Thanks, everyone.
Thank you.